good evening, everyone, and welcome to Meet Touchstone Essentials Live Product Training Edition. I'm here with Cindy Klement, who is our instructor tonight. And Cindy, as you know, has written a book, Your Body's Environmental Chemical Burden. And boy, it's got all kinds of awards. I encourage you to look into it and give it a read because it's fantastic. Cindy is an accomplished speaker, published author, nutritionist, herbalist, adjunct professor, and somebody who I've known for quite some time, and she's passionate about empowering audiences to live as vitally as they can in our toxic-ridden world. And boy, what a toxic-ridden world it is, right, Cindy?
Oh, boy, in more than one way.
Well, tonight, we are going to talk about vitamins, and we're excited about that and how vitamins in Touchstone Essentials products can help improve your health. So, Cindy, with that, we'll turn it over to you.
Very much. I'm really happy to be here this evening, everyone, to share the information on how we can obtain the vitamins that we need from food sources and not just swallowing, tablets and capsules. One of the things that I want to point out is that a lot of nutrients are either reduced or destroyed during cooking or heating. And what's wonderful about Touchstone Essentials food supplements is that they're harvested at the peak nutrition, and then they're cold pressed to capture all of those essential nutrients and not destroy them. So I'm really happy about that. Oh, hold on, my clicker isn't working. I'm trying to do a new clicker here, Craig. So I don't make such noises. All right, well, I guess I'm going to use it manually tonight. There you go. All right, no problem. Vitamins come in two different classifications. They're either water soluble, which means that we have to replace them several times throughout the day. And those would be the B complex and the vitamin C. But there are also what we call fat soluble vitamins, and those are what we store in the body. So we don't necessarily need to have higher amounts or anything like that because they're stored, and those would be the vitamin A, D, E, and K. So what I want to do tonight is I want to take a look at each of these individual vitamins, and then so we have a better understanding of what these vitamins do in our body and then which foods contain these nutrients. So let's begin with vitamin A. Now, first of all, I want to tell you that on the slide, you'll see these little codes. I was trying to think of a way to explain where all these products are. So I'll give you my code where it says SGJ, that's super green juice, and the E is for essentials. The OSP is organic super protein. So when you look at this and we're talking about vitamin A, you can at a glance see where these products are in Touchstone Essentials. So vitamin A, as I mentioned, is a fat soluble vitamin, and so it's stored in the body, but we need it and quite a bit of it because we need it for our vision health, for our cornea health. We need it for our mucous membrane. So think of our sinuses and our respiratory system, for our digestive system, our intestinal system. We need it for the growth of our skin, our bones, our teeth. We need it for our reproductive system. We need it for our immune system. We need vitamin A for our thyroid gland and the nerve sheath that covers our nerves. And vitamin A in the body also helps to manufacture red blood cells in the body. The interesting thing is that the World Health Organization, WHO, states that more than 124 million children around the world are vitamin A deficient. And with just improved nutrition, this vitamin A could prevent the death of over 300,000 children every year under the age of 5. So folks, they're all very important vitamins, but vitamin A really is something. So if we don't have enough vitamin A in our body, we can experience problems with our eyes because we need it for cornea health and eye health. But it could be something like dry eyes or night blindness or problems, like I said, with our cornea. We could also be experiencing rough or dry skin or a vulnerability to infection, because remember, it's needed by the immune system. It also helps prevent inflammation in the body. Now, as you can see, these are the food sources of vitamin A, and this is where we find them in Touchstone Essentials products. So we've got super green juice, essentials, and organic super protein for our vitamin A sources. Now, when it comes to thiamine or vitamin B1, what this vitamin, and this is a water soluble vitamin, so we need to replace it several times throughout the day. Thiamine helps us convert the carbohydrates that we eat into a usable form of energy. And if we're active and we eat lots of carbs, we need more vitamin B1. And if you eat a lot of dry snack foods or cereals or things like that, you also need more vitamin B1. And they realized this about 80 years ago. They developed what's called the Enrichment Act of 1942, I believe it is. And what they did is they required that thiamine, vitamin B1, be added to processed foods to compensate for the loss in processing these dry snack foods and these dry cereals. And they also included in that riboflavin, vitamin B2, as well as iron. And then about, probably 25 years or so later, they actually added vitamin B9, folate, to that list of nutrients that have to be added to all of these dry snack foods and grain products. Now, the deficiency symptoms of thiamine include things like just having really weak muscles, or just apathy, a lack of interest or enthusiasm or concern about life. You might find yourself a little bit more irritable, or have a loss of appetite, or a poor short-term memory or confusion. So the food sources of vitamin B1, and you can see it, here it is again, super green juice, essentials, and organic super protein. If you're using those on a daily basis, you're getting your vitamin B1. Now with vitamin B2, which is known as riboflavin, what this particular B complex water soluble vitamin does is it helps to build and maintain body tissues. It helps us, again, metabolize carbohydrates and fats and proteins. It's also very useful for making red blood cells. And it protects us from common skin disorders or common eye disorders. And this is interesting. If you don't have enough vitamin B2, it's very difficult for you to absorb vitamin B3 and vitamin B6, because the B complex family all works together. And just like thiamine, the more active you are, the more of this vitamin you need. So when I talk about the deficiency symptoms of the B complexes, all of them, you'll see a pattern here. We talk a lot about the mouth, what happens in the mouth, on the skin, the eyes, and things like that. So for instance, with a deficiency of vitamin B2, there could be these cracks or redness in the corners of the mouth, or a very painful or red, or even like a purplish tongue. It can be an inflammation in the mouth, or scaly, dry skin, and even sore throats, common sore throats. But on a side note, I want you to know that there are pharmaceuticals that deplete vitamin B2. So for instance, they actually deplete a lot of the vitamins, but in the case of vitamin B2, just as an example, oral contraceptives deplete the B2. So we need even more. The antidepressants do the same thing. Phenobarbital, gout medication, all of those deplete your vitamin B2. So we need to, again, it's a water soluble, we need to replenish it during the day. And again, this is true for many of the other vitamins and minerals that we need. And it's not typically communicated to a patient who goes on these pharmaceutical drugs. So even the over-the-counter drugs have the ability to deplete a variety of nutrients. So interestingly, sometimes it's what we call a cyclic problem. And by that, I mean the condition that we are treating with the pharmaceutical could be a result from a nutrient deficiency in the first place, but then taking that pharmaceutical can further exacerbate the problem and continue to deplete that vitamin that we needed in the first place. Now, I'm not saying that happens all the time, but as a nutritionist with, over 40 years experience, I can tell you that a number of my patients have had numerous medications that they've been taking and it completely depleted in so many of the nutrients that once we built the nutrients back up in their bodies, they were able to get off some of those medications. So luckily for us, if you're using Super Green Juice, you are getting your vitamin B2 from the spirulina that it contains. So vitamin B3 is also known as niacin. And what, again, when we think about B complex, it's energy and skin and mouth and all of that. So vitamin B3 protects the skin. It protects our nervous system, our digestive tract. And if we don't have enough vitamin B3, our energy reactions are blocked in the body. So there's more and more fatigue. So of course, the deficiency symptoms, if we have our energy blocked, means that we're going to have more weakness and fatigue, or because it helps with our digestive tract, we might have diarrhea or abdominal pain and inflamed and swollen tongue. A lot of the B complex, we call them the morale vitamins because they have a lot to do with our mood. So if we don't have enough niacin, perhaps we could experience some depression or that apathy again, or memory loss, some type of skin disorder or inflammation, and headaches and things like that. So the food sources, again, for our vitamin B3, as you look at the code here, we've got Super Green Juice, Essentials, Super SGD is Super Greens plus D. So you can see, for instance, Jerusalem artichoke is in 3 of those products. So we're getting a lot of B3 through these supplements. Now, pantothenic acid is vitamin B5, and panto really means, it kind of means everywhere, because it's everywhere in your body. Vitamin B5 helps our body produce hormones. Vitamin B5 helps to regulate our nervous system. And like most of these other water-soluble vitamins, food processing destroys this vitamin B5. For instance, if you're canning your fruits or vegetables, you can lose between 50 and 60% of this vitamin B5, whereas the frozen fruits and vegetables can on average lose anywhere from 20 to 40% of these B complex. So again, we need more of these, and we want them picked at peak nutrition time and then cold press, so we're not having to deal with these deficiencies. And again, as I mentioned, the vitamins are reduced by certain things, certainly heat, but also if you consume alcohol, that can deplete the vitamin B5 and some of the other vitamins. Acid beverages, dyes, caffeine, too much sodium, drying, heating, milling, freezing, even the air can deplete our vitamins. Irradiated foods, prolonged cooking in water where you're boiling or blanching, or cooking with aluminum foil can help to deplete these nutrients that we need. So the deficiency symptoms of pantothenic acid include things like, again, B complex, so weakness and fatigue, immune system, so we have reduced antibody production. And because bees work on digestion, a deficiency in vitamin B5 can lead to nausea and stomach cramps, muscle cramps body-wide, numbness, reduced functioning of the adrenal glands, hypoglycemia, as well as, again, let's go to the morale vitamins. So without enough B5, we've got insomnia, depression, irritability, restlessness, apathy, all those types of things. So once again, you can see on the slide, where are we getting our B5 in Touchstone Essential Products? Here it is, super green juice, essentials, and organic super protein. All right, so now we're at vitamin B6. Pyridoxine is how it's pronounced. And vitamin B6 is needed for more than 100 enzymes involved in protein metabolism in our bodies. So the more protein that we eat, the more we need of vitamin B6. The skin, again, the nervous system, again, they need vitamin B6 to function properly. And vitamin B6 also helps us to maintain a proper blood glucose level, keeping it within that normal range. So the deficiency symptoms of not having enough B6 in our body, once again, skin diseases, dermatitis, red, swollen, sore skin, or tongue or mouth sores, anemia, because a lot of these B complexes help us to produce these red blood cells, blood sugar issues, again, nausea, that digestive area, as well as that mood elevation. So nervousness, depression, confusion, even convulsions. And most people know about this, is that a deficiency of vitamin B6 can also lead to PMS and carpal tunnel syndrome. So once again, here are the food sources where we get our vitamin B6 from our Touchstone Essential products. So super green juice, essentials, and the organic super protein. Now, biotin is a different kind of a thing. It's produced by our intestinal bacteria. So our intestines have to be healthy in order for us to produce this vitamin. And a deficiency symptom of vitamin B7, biotin, is, again, depression, hallucinations, apathy, numbness or tingling in the arms or legs, and then this red, scaly skin, especially around the eyes and the nose and the mouth, as well as hair loss. So once again, these are the food sources. And once these foods get into our gut, if our intestines are healthy, we can create and manufacture our own biotin. Vitamin B9 is folate, and folate is extremely necessary for the production and the maintenance of all new cell growth in the body. And folate protects the DNA in our body. So it's very important during pregnancy for the growth and for the safety of the baby, so that we don't have problems in pregnancy. It's important for our bone marrow and producing red blood cells. It promotes the health of the intestinal tract. And if a person has been severely burned, or they've had a lot of blood loss, or they have skin diseases, they need even more of this folate. So the deficiency symptoms of not getting enough folate are birth defects, anemia, the nervous system and the brain just not working well at all. Maybe a person feels irritable, or they're confused, or they can't sleep at night, or they're weak or very tired all the time. Maybe a little bit of shortness of breath or some headaches. And importantly, something called elevated homocysteine. And when we have elevated homocysteine levels in our blood, which is easily detected in a blood test, it can increase your risk for dementia, for heart disease, and stroke. So folate is extremely important, both prenatally, all through nursing, and really all through life. So where are we getting it? Super green juice, super greens plus D, as well as essentials. Now, vitamin B12, this is cobalamin. And vitamin B12 is used in the production of new cell growth. It helps maintain our nerves, the nerve sheath that covers those nerves. It helps to break down our fats and proteins in our diet. And along with vitamin B9, it helps to make red blood cells. So the deficiency symptoms of not having enough B12 are pernicious anemia, malabsorption, can't absorb the nutrients out of our food, psychiatric disorders, neurological changes, including deafness. So this, again, they're all important vitamins for different reasons, but here you see, once again, the food sources of vitamin B12, your super green juice and your super greens plus D. Now, vitamin C, I couldn't fit all the symbols on the slide, but I'll tell you about this one. Vitamin C helps to maintain collagen in the body, the connective tissue. It helps our bones be strong, our teeth more strong. It keeps our capillaries and our blood vessels strong. It's needed by our thyroid and our adrenal glands for proper functioning. And the more stress we're under, the more vitamin C we need. It helps to strengthen our resistance to infection, and it is considered the most fragile vitamin because it has an extremely high sensitivity to heat and oxygen. So it's a little bit tricky with vitamin C. Now, there's a whole list of symptoms for a deficiency of vitamin C, but they include anemia, again, very tired and weak. So think of all of these water-soluble vitamins. They all give us that energy and vitality. They work on our morale, our, feeling good and having a happy brain. Because if you don't have enough vitamin C, you might feel a little bit irritated or have some depression or even hysteria. Without enough vitamin C, there can be muscle degeneration and pain, very poor healing. So if you've cut yourself and you notice it just takes forever to heal, that's a sign that you're not getting enough vitamin C. If the skin is very rough, if we have that atherosclerotic plaque accumulating in the main arteries, if we have weak capillaries, or if we tend to hemorrhage a lot, or when we cut ourselves, there's a lot of bleeding, or we have these blotchy bruises on our body, or bleeding gums or loosened teeth. So vitamin C is extremely important. And without going through each one of these, suffice it to say that you get your vitamin C in your organic super protein essentials, super greens plus D, as well as the super green juice. So good stuff, folks. Now, vitamin D is another one of those fat soluble vitamins. Remember, it's vitamin A, D, E, and K. And vitamin D is, I always say, an important vitamin. They're all important, but vitamin D helps to promote our bone health. It helps to increase the absorption of calcium in our body. It's needed by our intestines. It's needed by our kidneys. It's needed for our immune health, for the health of our brain and our nervous system. It's needed by the reproductive organs. And interestingly, vitamin D helps protect us from certain cancers as well as MS. Now, deficiency symptoms of vitamin D, again, the list is long, but the most common are deformed or soft or even brittle bones, or having a lot of bone pain in the pelvis or the lower back or the legs, or things like that. So an excellent source of vegetarian source of vitamin D is mushrooms. And as you can see, mushrooms are found in super green juice, super greens plus D, as well as essentials. Now, vitamin E. Vitamin E is needed for growth of our cells, again, for healing our tissues. And because it's a fat soluble vitamin, vitamin E has an affinity for the cell membrane. The cell membranes are lipids, so they're fats, and vitamin E helps to protect that cell membrane, and it also protects the good fats that are in our body. And the food sources of vitamin D are from super green juice, essentials, organic super protein, and super greens plus D. So you can see that if you're using these supplements, or I don't want to call them supplements because I think of them more as food, if you're using these food on a daily basis, you're getting the vitamins and minerals that you need. So vitamin K, like biotin, it's made by bacteria in the gut. So again, the intestines have to be healthy. Vitamin K acts primarily in blood clotting, so we don't bleed to death when we cut ourselves, but also our bones require it. So if you look at the slide, you can see that we get our vitamin K in essentials, super green juice, super greens plus D. So really, these products are very well made and very much appreciated. Now, I want to show you, or just kind of explain to you, years ago, I was doing a report and writing an article for someone, and I was looking at over-the-counter vitamin supplements, and I'm not going to mention the brand name, but I found one over-the-counter vitamin in a drugstore. So it wasn't a very high quality one, but it's a very popular brand. And I'm not going to list all of the ingredients that I found in this particular product, but some of them were so difficult. Something called hypromolose. Folks, hypromolose was one of the ingredients in a vitamin. This is a chemical that's used in plastics production. There was another ingredient, polyethylene glycol, and that's derived from petroleum products, the fuel that you put in your car. They had, of course, synthetic copper in it, and they had a synthetic vitamin K in it called a phytonadione. So I like to get things from my vitamins from food sources that I can pronounce. But interestingly, this was a vitamin that was for younger children. And in it, it had FD&C yellow number 5. Now, folks, FD&C yellow number 5, you can look it up. It's known to cause allergic reactions such as asthma and hives. And it also has a possible connection to cancer. FD&C yellow number 6 is derived from petroleum, but FD&C blue number 2 is what it was called. It increases hyperactivity in children. So imagine that you've got this kind of junk in a traditional vitamin supplement and you're giving it to your child. You know, it's just, again, I like to get my vitamins from things I can pronounce and in the form of real food, and I'm sure that all of you do as well. So remember, Touchstone Essentials ingredients are harvested at the peak of their nutrition. They're cold pressed and they've captured all of those essential nutrients. And they're rich in all the vitamins that we've discussed tonight. So when you incorporate them into your daily health regime, you're provided an excellent source of these vitamins and other nutrients that we've talked about, you know, for so many months without having to purchase and prepare dozens and dozens of different superfoods every day, or just take handfuls of questionable supplements. So enjoy these products and take them into, add them into your daily regime for the sake of your health. So that concludes tonight's presentation, everyone, but I want you to mark your calendars for 2 weeks from tonight, which is March 17th, because we're going to continue. We're going to kind of have a part 2 of this, but this time we're going to focus on minerals and show you where we get these minerals in our food. So it's back to you, Craig.
Thank you, Cindy. Wonderful job. It really is interesting to learn about vitamins. And I love when you showed that picture of our products to see how different our vitamin supplements, our multivitamins are from every other multivitamin that's out there, right?
I agree. I completely agree.
It is really awesome that we have these vitamins from Whole Foods. It makes a real difference. They're whole food compounds that provide the vitamins and the minerals that we need. And I love the fact that our vitamins and minerals are so different than everything else that's out there on the shelf. So thank you for making this more clear to us tonight, Cindy. We appreciate you. Thanks, ladies and gentlemen, for being with us. Everybody have a great night, and we'll see you on the 17th to learn all about minerals.
Good night, everyone.
Night, everybody. Bye-bye.